insomnia, anxiety that comes out of nowhere, racing thoughts at night, weight gain that doesn't respond to diet or exercise, heavy or irregular periods, lost pregnancies with no clear explanation, feeling wired, tired, exhausted, and emotionally overwhelmed. This is the misery many women enter when progesterone begins to decline, and most are never told what's happening. I know I wasn't. Just one of the many reasons in that perfect storm when I had breast cancer at 29. Progesterone doesn't wait until menopause to fall. It often begins declining at a rate at age 25. By 35, many women have only half the progesterone they once had. Estrogen may still look normal on labs, but progesterone is already missing, creating estrogen dominance and nervous system instability. Progesterone is a protective, calming, organizing hormone. It balances estrogen, protects tissues, calms the brain, supports fertility, and maintains pregnancy. Lindsay Berkson, author of Safe Hormones, Smart Women, states that progesterone is our protector, our policer, and it is just that. In the brain, progesterone affects the GABA receptors, which are the same calming receptors targeted by benzodiazepine medications. This is why we call it nature's Ativan. Through its metabolite, allopregnanolone, progesterone quiets the nervous system, reduces anxiety, and allows the brain to shift into deep, restorative sleep. Progesterone is also neuroprotective. It helps protect nerve cells, supports repair of the myelin sheath, and stabilizes nerve signaling. This is why progesterone is being actively studied in traumatic brain injury and stroke patients, where it shows promise in reducing inflammation, protecting neurons, and improving neurologic recovery. In the uterus, progesterone stabilizes the uterine lining and maintains pregnancy. It keeps the uterus relaxed, reduces inflammation, and prevents immune rejection of an embryo. Without adequate progesterone, implantation can fail, miscarriage risk rises, and abnormal bleeding becomes common. Progesterone also protects against estrogen dominance. Estrogen stimulates growth. Progesterone slows that growth, organizes it, and promotes healthy cell differentiation. This protection reduces the risk of breast cancer, uterine cancer, endometrial overgrowth, fibroids, and estrogen-driven inflammation. This balance matters in lipedema as well. Estrogen dominance drives abnormal fat deposition, inflammation, fibrosis, and vascular dysfunction. Progesterone helps counter these proliferative effects, supporting healthier adipose and connective tissue signal. So what happens when progesterone is low? Sleep disappears, anxiety rises, weight becomes resistant, estrogen becomes unopposed. Fertility declines, inflammation increases, the nervous system stays in overdrive. Progesterone is not optional. It is protective, calming, essential. When restored correctly and bioidentically, it doesn't just relieve symptoms, it helps restore balance, resilience, and protection at the deepest level. And please, this is for educational purposes only. See me to keep your protective policing progesterone levels up to par. I'm Carla Horton, AGNP in Scottsdale, Arizona.